Hello friends, and welcome to my channel. I am your host Dr. Santosh, ENT and head and neck surgeon. As a doctor, you are frequently asked to interpret x-rays, to read the x-rays, and today I am going to teach you how to read an x-ray of the adenoids. X-ray adenoid is a common x-ray taken in pediatric ENT in childhood to look for the enlargement of the adenoids, which is a part of the Waldeus ring. This is a picture of Waldeus ring. As you can see, the Waldeus ring contains the adenoids, the palatine tonsils, the tubal tonsil and the lingual tonsil. Reading the adenoid X-ray is an important exercise in the third year M.B.B.S curriculum. This is a picture of palatine tonsils, which are popularly known as the tonsils. This is a picture of adenoids, which is a gland that occurs at the roof of the nasopharynx. That is why it is also called nasopharyngeal tonsils. This picture shows you X-ray of the adenoids, nasopharynx, lateral view. Let us learn how to interpret this X-ray. This is a cross-section of the head showing key anatomical areas that you must look for on an X-ray of the adenoids. These are marked by the various colored arrows. The prevertebral shadow, which is caused by the soft tissue of the prevertebral muscles, is marked with a blue arrow. The epiglottis, which is a leaf-shaped cartilage that guards the airway, which is seen in the cross-section here, has been marked with a red arrow. And the airway, which contains air and casts a black shadow on the X-ray, has been marked with a yellow arrow. And finally, the adenoids, which is the nasopharyngeal tonsil, is marked with a green arrow at the roof of the nasopharynx. These are the three key areas you must look for in an X-ray of the adenoids. Let's look at all these structures on a real X-ray. Do you know the vertebra is called spine clinically, and the shadow produced by the soft tissue in front of the vertebra is called the prevertebral shadow, marked here with a circular shape. The second key area is the velicular shadow, which is marked here by the polygon, and there is a natural curvature of the vertebra. The natural cervical lordosis is marked with a green line. The loss of C-shaped curvature or natural lordosis occurs in many diseases of the head and neck, namely acute retropharyngeal abscess, acute epiglottitis, and so on. Here is an interesting X-ray to begin learning. You can see immediately that the C-shaped cervical lordosis has been lost. The loss of cervical lordosis has been marked with the blue arrows, and you can immediately see that the air shadow, the air passage, is no longer continuing downwards into the mediastinum. This is called velicular cutoff sign. As you can see, the truncation of the air shadow is called velicular cutoff sign, and you can see the swelling of the epiglottis, which is marked by the red arrow and which appears like a thumb, and this is called thumb sign. So the truncation of the air shadow, the thumb sign, and the loss of cervical lordosis points us towards the diagnosis of acute epiglottitis. This is an airway emergency in children. You must remember never to perform an examination or try to use a tongue depressor on such a child, because you may cause an airway obstruction and the child may lose his or her life in front of you. This is another schematic diagram of the lateral view. The airway shadow has been marked with black color as an overlay on this picture, and the epiglottis shadow has been marked with the blue arrow. So this schematic diagram helps you understand the X-ray appearance of acute epiglottitis. This is another interesting X-ray of a child who has fever and breathing difficulty. Here you can see there is an increased widening of the prevertebral shadow. There's like a soft tissue occupying in front of the vertebra. In addition, there is a loss of cervical lordosis, which is marked by the blue arrow. So this is an X-ray of an acute retropharyngeal abscess, another febrile airway emergency in childhood. So, in a brief recap, you look at the cervical spine, you will look at the prevertebral shadow, you look at the vallicula, and then you look at the state of dentition. Here you can see an impacted molar or an unerupted molar in both the upper and the lower jaw. And then you look at the nasal cavity, the Turkish saddle or the pituitary fossa, and underneath that you look at a soft tissue shadow in a C-shaped, which is the adenoids. Here in this X-ray you can see the enlarged adenoid which is impinging in the airway. Here in this X-ray the enlarged adenoid has been marked with a small white arrow. In addition, you can see metallic density round foreign bodies which are probably the earrings worn by the child. I hope this session was useful to all. Thank you.